Hi everyone, just a quick update. Um, Conference organising seems to be going okay. Still need to get more donations for our budget. Um, be working on this next week. But next week I also have a follow-up test to look at something at the back of my eye, my retina, on the sort of left temporal side, um, periphery, that initially on an Optus wide vision scan um, was picked up as an incidental finding. I don't know how new it is or if it's historic. The optometrist, actually more than one, said it looks like a historic scar, but we can't be sure. I got the images sent to the ophthalmologists that I go and see. I saw them last 3 years ago for a completely different scenario. But that technology, the Optos technology, wasn't available back then. So I'm not sure if they didn't see it or if it's something new. But they looked at the image and they said, well, that doesn't really look like a scar. And so it's this kind of bordered, pigmented area, sort of brownish, but with a really obvious white contour and a bit of, um, sort of whitened area as well. It looks kind of geographic. So we're not really sure what it is, and the whole point of doing further tests, probably OCT and maybe ultrasound, OCT of the actual lesion to see if it's flat, doing the ultrasound, doing further imaging to look at the characteristics of the pigmentation, the thickness, and so on. That's to rule out some more pathological things, but it could be everything from retinal scar to something that is more of an inflammatory process that perhaps isn't active, but it could be toxoplasmosis ocular. There's a range of things it could be. It could be just a hyperpigmentation issue with related inflammation, a congenital variation. It's ambiguous. So I got to hold my hat on because it's not the first time in my life that I've had imagery done and things have been suggestive of conditions, but that don't turn out to be pathological. For a number of years, I was developing breathing problems, and there was a working diagnosis of COPD, and I was given medication for that, which seemed to help. But I was also imaged like 3 times by CT chest, and I had atelectasis, or however you say that word. I don't know. But it's like where there's a bit of collapsed area of your lung or scarring. Again, like then I was run through a PET scan to see if there was any kind of tumor involvement. Anything that it picked up was an area of, the juncture where your esophagus kind of ends, and the neck that enters to the stomach. And again, like I had to have a gastroscopy, and it turned out to be sort of I guess ulcer that wasn't bleeding or anything, but it was treated. So you go down all sorts of rabbit holes with medical imagery and investigations, differential diagnoses. I don't think that that's so much the case with when you go and see an ophthalmologist. I think that it's much clearer, it's more binary, and they can determine what's going on. But at this stage, I'm not worried about anything pathological or necessarily active. But I have a slight suspicion that it could be ocular toxoplasmosis that maybe lay dormant for a while and then became active and then caused inflammation in a scarred area with pigmentation. So as much as I'm not a specialist in this area, that's actually my working hypothesis until Tuesday when I find out. So I'll let you know, and sorry for the mispronunciation of scientific terms there, but I have been put through the ringer of the years, including with my thyroid. So imaging, ultrasound imaging picked up something that looked calcified and dense, a kind of nodule, and it was staged as T4 and advised to monitor, but so it wasn't 1.5 where one presumes that it's cancer or carcinogenic. It was 1.2, so very much on the borderline, but with those characteristics. And I decided to just break rank and go and have a fine needle biopsy, aspiration biopsy of the area, and it was a hyperplastic mass, which has nothing to do with cancer, and I was given a best theta 2 classification. So sometimes you can get put through all sorts of motions, sometimes driven by yourself. For example, the historic scar imagery of the temporal peripheral section of my right eye retina. That was actually something I decided to kind of escalate and send to my ophthalmologist, because I know that they're better at ascertaining what something is, and that you can't just go on the basis of a quick assessment on an image. So I'm trying to be sensible about all these things while also not catastrophizing. And as I said, it's so familiar to me. There's lots of quirks with images. I even remember having I think it was a chest x-ray, and it was alleged that I had an enlarged heart, but it was actually an artifact of the imagery, because when it was repeated it was normal. Now that's not the same as what we're looking at with the Optus wide scan, which is 175 degrees. Previously the tech had only been about 60 degrees, and so couldn't really scan those areas. But it's created an interesting quandary. I don't have any symptoms, and I did a visual field test and it was perfect. And it's completely incidental because, as you probably noticed, I'm not wearing my glasses because I lost them like on Wednesday last week, and then I'm like, oh my god, I have to go and get an eye test again. It had been nearly a year, and I just happened to have this new Optos technology, this scanner, and that's what picked it up. So we'll see how we go. Wish me luck.